Welcome to my channel. In this video, we are going to learn about cubital fossa. It is triangular hollow in front of the elbow. Its base is directed upwards. Its apex is directed downwards. It corresponds to lower half of popliteal fossa of the lower limb. It corresponds to lower half of popliteal fossa of the lower limb. Boundaries. This is medial side. This is lateral side. Boundaries of cubital fossa are medially lateral border of pronator teres. This is medial border. This is lateral border. Medial boundary is formed by lateral border of pronator teres. Lateral boundary, it is formed by medial border of brachioradialis. This is medial border of brachioradialis. This is lateral border of brachioradialis. Lateral boundary is formed by medial border of brachioradialis. Base. It is formed by an imaginary horizontal line joining the two epicondyles of humerus. Base is formed by imaginary horizontal line joining the two epicondyles of humerus. Apex. It is formed by meeting point of medial and lateral boundaries. Floor. It is formed by two muscles. Brachialis in the upper part, supinator in the lower part. Roof. It is formed by skin, superficial fascia. Superficial fascia contains median cubital vein, lateral cutaneous nerve of forearm, medial cutaneous nerve of forearm. Below the superficial fascia, deep fascia. On the medial side, deep fascia is reinforced by bicipital aponeurosis. Roof is formed from above downwards by skin, superficial fascia containing median cubital vein, lateral cutaneous nerve of forearm, medial cutaneous nerve of forearm. Deep fascia reinforced on the medial side by bicipital aponeurosis. Contents from medial to lateral. Remember the mnemonic MBBS. M. Median nerve. B. Here we might get confused between tendon of biceps brachii and brachial artery. Remember the mnemonic MBA. MBA can be done after MBBS. So remember MBA, M. Median nerve, BA. Brachial artery. Adjacent to median nerve, there is brachial artery. Lateral to brachial artery, tendon of biceps brachii. S. Superficial branch of radial nerve. From medial to lateral, median nerve, B. Brachial artery, B. Tendon of biceps brachii, S. Superficial branch of radial nerve. Now let's see each content in detail. Median nerve. It leaves the fossa by passing between two heads of pronator teres. Pronator teres has superficial head and deep head. Median nerve leaves the fossa by passing between two heads of pronator teres. Brachial artery. It lies just lateral to median nerve. It terminates in the fossa at the level of neck of radius by dividing into radial artery and ulnar artery. Radial artery, it is superficial. It leaves the fossa at the apex. Ulnar artery, it is deep and passes deep to pronator teres. Ulnar artery passes deep to pronator teres. Radial artery leaves the fossa at the apex. It is superficial. Tendon of biceps brachii. It runs downwards and laterally. You can see it is going laterally. It passes downwards and laterally to get attached to radial tuberosity. It passes downwards and laterally to get attached on the radial tuberosity. Superficial branch of radial nerve. Radial nerve lies in gap between brachialis medially and brachioradialis laterally. Radial nerve lies in gap between brachialis medially and brachioradialis laterally. At the level of lateral epicondyle, radial nerve divides into superficial and deep branches. Superficial branch of radial nerve is called superficial radial nerve. Deep branch of radial nerve is called deep radial nerve or posterior interosseous nerve. Posterior interosseous nerve disappears in the substance of supinator muscle. Superficial radial nerve passes downwards in front of the forearm under the cover of brachioradialis. Superficial radial nerve passes downwards under the cover of brachioradialis. Clinical anatomy. Median cubital vein in this region is the vein of choice for collecting blood samples and giving intravenous injections. It is vein of choice for collecting blood samples and for giving intravenous injections. Brachial artery in this region lies just medial to biceps tendon and it is auscultated universally for recording blood pressure. Brachial artery in this region lies just medial to biceps tendon and is auscultated for recording the blood pressure. In case of supracondylar fracture of humerus, median nerve and brachial artery may be injured. Let us now revise cubital fossa. It is triangular hollow in front of the elbow. Boundaries: medially lateral border of pronator teres, laterally medial border of brachioradialis. Base: imaginary horizontal line joining two epicondyles of humerus. Apex: meeting point of medial and lateral boundaries. Floor: formed by two muscles. Brachialis in the upper part, supinator in the lower part. Roof: from above downwards it is formed by skin. Superficial fascia containing median cubital vein, medial cutaneous nerve of forearm, lateral cutaneous nerve of forearm. Deep fascia reinforced on the medial side by bicipital aponeurosis. Contents: from medial to lateral, MBBS, median nerve, brachial artery, tendon of biceps brachii. S. Superficial branch of radial nerve or superficial radial nerve. Clinical correlation: median cubital vein is the vein of choice for collecting blood samples and for giving intravenous injections. Brachial artery, which lies just medial to tendon of biceps brachii, is auscultated for recording blood pressure. In case of supracondylar fracture of humerus, median nerve and brachial artery may be injured.